Well, coronavirus hospitalizations are nearing record levels in the U.S. The healthcare system is once again on the brink. Nearly a quarter of the nation's hospitals are seeing critical staff shortages.
Child hospitalization for some age groups is setting new pandemic records, and the rise in adolescent cases fueling the debate over how to keep kids safe in schools. CNN's Alexandra Field has details.
Parents are outraged, and they are making their outrage known to the teachers union. This is a very different dynamic than ever before.
Tensions mounting in Chicago. More than 340,000 students missing school for a fourth day. Their teachers refusing to return to the classroom.
We're very frustrated that there are no public health leaders standing up and saying that we should be moving to a remote learning environment, especially for a district of this size.
In Los Angeles, students are due back in school in person tomorrow, with widespread testing turning up some 50,000 positive cases in the district. Metro Atlanta schools also returning to in-person learning after almost a week of going remote. The largest district in the nation, New York City schools, started the new year in person. So far, just one single classroom in partial quarantine.
I think at this point, there's really no good explanation for having remote schools.
Still, disruptions ripple throughout the country. Some students in a Greensboro, North Carolina district are without school buses due to a bus driver shortage made worse by rising COVID-19 cases. And a more dire situation for hospitals. Nearly 1 in 4 nationwide now reporting critical staffing shortages, federal data shows, while COVID hospitalization numbers near the pandemic's all-time high.
Among unvaccinated people and among unboosted high-risk people, it is putting a big strain. And given how much infection there is, our hospitals really are at the brink right now.
For children, average daily hospitalizations are well above any pandemic peak we've seen before. More than 800 children are being hospitalized with COVID daily. Children who can't be vaccinated or aren't vaccinated make up the majority of those cases, according to the CDC director, Dr. Rochelle Walensky.
And for those children who are not eligible for vaccination, we do know that they are most likely to get sick with COVID if their family members aren't vaccinated.
Amid a shortage of COVID tests nationwide, some testing labs report they're already overburdened. The University of Washington prioritizing tests for those with respiratory symptoms or a known exposure. The University of North Carolina Medical Center in Chapel Hill also restricting tests to those showing symptoms, university employees, and people needing a test before surgery, with the Omicron crush not letting up yet.
If you look what's happening across the East Coast right now, New York City, Washington, D.C., Maryland, probably Florida as well have already peaked, maybe Delaware and Rhode Island. You're going to start to see that in the statistics this week. You're going to start to see those curves, those epidemic curves bend down. You're already seeing that in New York City and Washington, D.C. The risk right now is to the Midwest, where you have rising infection.
It is the fourth day with no school. The teachers union and city officials remain deadlocked, maybe even further apart, it can feel at this point. At issue here, of course, is how to get students and staff safely back into the classroom. The teachers union wants increased safety and testing protocols and also the opportunity to teach from home until the current surge peaks. They've eyed January 18th as a potential date to resume in-person learning. City leaders, they just want everybody back in the classroom now. Families and students, meantime, are struggling as they wait for school to start. Jackson Potter is a high school social studies teacher at Back of the Yards College Prep in Chicago. He's also a trustee of the Chicago Teachers Union's executive board. I know you've been, I believe, 20 years you've spent in Chicago public schools. At this hour, is there any word of progress, any updates on negotiations or even a possible deal?
I think that things are progressing and there's been movement around key areas such as contact tracing, testing, ensuring that there's a metric if there's an out-of-control outbreak at a school, that be a school that's paused. So I am hopeful, but still a lot of work to do.
So you say you're hopeful. You know, you've likely heard about this petition. A Chicago Public Schools mom organized a petition urging the teachers union to get back in the classroom, to reopen schools. She was on CNN earlier today. She says the science on safety in schools is clear. Take a listen.
We saw over the holiday break, we saw our teachers going on vacations and visiting families, and they absolutely should be doing that. But to return to school 3 days later and say that they don't feel comfortable being in the classroom when the public health community says it's safe, and the rates within the community of kids is lower than what they face when they go to the grocery store or when they get their nails done or when they're out in just the general community living their lives. You know, we have to move on. We have to live our lives with this pandemic. And so we really want the teachers to get back to work.
How would you respond to her, Jackson?
Yeah, we absolutely want to get back to work too. In fact, we wanted to work all along and we're locked out of our classrooms. Part of the problem is when we came back from break, I'll give myself as an example. I saw 5 times the number of students in quarantine. This thing was spreading rapidly. Many of my coworkers were starting to call in absent because they got sick with COVID, and it was beginning to break out. Our students, I have 1,000 students in our school. They all eat lunch without masks together. So the idea that it doesn't spread in schools is even refuted by the state's public health data, which shows that school transmission is the top way that COVID has spread. And then you look at Chicago Public Schools' own data, just from 2 days last week of in-person schooling, there were 2,400 identified positive cases of teachers and students, 9,000 in quarantine, and that was expanding exponentially. So, I mean, Omicron expands rapidly. We did not have the mitigations in place necessary to detect it, and yet here we are.
So you talk about not having the mitigation in place. Look, we can visualize, right, what could happen at lunch. There can be separation measures, as we know. I mean, I see it in my public schools. It's not ideal. I can tell you my 6th grader hates it. But in the way that they split kids up and they rotate lunch, we know that there was some movement over the weekend. You've got 91% of teachers, I believe, who are vaccinated within CPS. CPS said over the weekend they're going to provide KN95 masks for all teachers and students. How important is that? Because I know masks are really important to you. What sort of a difference would that make in terms of slowing the spread there and allowing for less transmission? Because we know overall, when you're masked in schools, transition can be very low.
Yeah, I think it's very important. Right now, the district provides cloth masks, and we know CDC guidance really says you need surgical masks or N95s or KN95s. And so my students were coughing, wheezing, sneezing that very first day back. We were all looking at each other, and they had those cloth masks. So having that at our, available at the school would be huge. Mm-hmm. That's why we got the federal money, is to purchase things along those lines. And I just want to mention too, it's not always understood. We're a vast majority Black and Latinx district, like 90%. And Black families are 2 times more likely to die from COVID, and Latinx families 3 times more likely. And our vaccination rates among students are fairly low among many schools across the district. So, the rise in pediatric hospitalizations, which have reached record highs in the state, is a real concern. And many of our students live in multi-generational families. So the risks are more high based on our demographics. And that needs to be talked about. And those mitigations are so critical. At my school, we had to carry out our own vaccination event because the district refused to. And, we were able to get 150 of my students vaccinated through those methods. But that was lifting heaven and earth by ourselves, not with the assistance of the bureaucracy. And that's what needs to change. We really need to do this together. That's why we took this action, was to ensure contact tracing is happening. Right now, I get notified that a student has COVID. Nobody asks me who they were sitting next to. Nobody calls to see who they eat lunch with. Nobody gives those students tests to determine if they've contracted the virus. So it spreads without detection. And that harms those families that are most vulnerable.
Jackson Botter, we have to leave it there, but appreciate you taking the time to join us this afternoon. And we're going to continue to follow this, and hopefully we'll be seeing some more developments. Thank you.
I hope so. Thank you.